This is Dr. Helen Su, and today I've been asked actually to start preparing a presentation for Asian American and Asian parents of Stanford students. And it occurred to me that some of the questions that were submitted might be things that other parents of bicultural kids are thinking about too, or generational differences. So real quick, the first question is, what is youth mental health, college mental health? Why should I care? And it just refers to the mental health, emotional, and behavioral of young people who, even if they're super smart and super healthy, between the ages of 15 and 25, they're actually at the most risk of any other age group to develop a mental health condition. It's a little bit because of brain development. Prefrontal lobes are not completely done yet. It's also because there's so much intense change at these ages in life between 15 and 25. A lot of stressors, lots of change, lots of social things, academic pressures, work pressures, family pressures. So every kid, 15 to 25, or young adult, is at a heightened risk. And so just like any other health issue, it's a really important thing to do preventative care. And that's what we're really here to talk about. That I've had parents say, well, I don't understand why I'm hearing so much about mental health, especially anxiety, in this generation, Gen Z or iGen. And if you want to look up some reading, Dr. Jean Twenge has some good research about this generation that, yes, it has clearly been shown this generation has very high levels of anxiety, starting much younger than previous generations. And some parents have asked, well, I don't think this was a thing. Like, why is this? I don't think we had this when we were younger. And I would say it's a combination of, I think we did have emotional health problems when we were younger, but we didn't know what to call them. We didn't know how to deal. And I know that's true because also I hear the young people tell me about the things they've seen, about their marital problems, sometimes the substance abuse, sometimes the depression and the overwhelm or anxiety or the past traumas that parents have lived through. And we don't hide it as well as we think we do, right? So maybe we just stoically took it before, or we didn't know how to get help. But actually now they have options. So we should totally take advantage of those. The other thing is this generation, although they have a lot of safety and more opportunity than most of us in the generation before, they also have grown up with things that no other generation has faced. They have lived with school shooting violence their whole lives, with the internet and constant social media pressures, nonstop forms of social pressure, academic pressure. They've lived through multiple economic collapses. They know about global warming and they have fears about their futures on so many different levels. And most of them have known about these things since they were little children. So we get a lot of young people who have a level of ongoing anxiety and dread that future generations didn't have in the same way. And that if you've been fortunate and been able to give your kids a much more comfortable life than you had, that is absolutely wonderful. But sometimes being comfortable or overprotected, helicopter parents, talking to you, means that they actually do not have faith in themselves. They haven't established a sense of self-efficacy, the ability to problem solve, to be confident that they can problem solve, that it's okay if they failed on something because they'll find another way. That sometimes we overprotect young people and they don't actually get to develop those skills until they're older. So it can be, there are books also addressing this is sometimes the problems of affluence or privilege. And basically just remember that just because your child may be very smart, functional, that has almost no correlation with how healthy they are emotionally. There are many people with what can be called high-functioning anxiety or depression. They may be able to do the things that they're supposed to do, so you might think everything's fine, but actually they may be having trouble sleeping, they may have trouble with their appetite, they may be having severe social problems or anxiety, or very negative or even very dangerous thoughts that you may not even know about because they look fine. That suicide has gone up for young people all across this country over the past 10 or 15 years. So mental health is really important. Even very intelligent, very loved young people can fall at risk of depression or having a very dangerous impulsive reaction after a big trauma or a loss. And this is all normal, no matter what ethnic group or income group that a young person is from. So my basic tip is for parents to get educated, learn in advance, treat it just like you did when they were little, that the more you know about developmental stages and what's normal, don't assume that you just know because of your experience. Read up on the research and find out how you can be helpful and what's normal and what's not. Find out what resources are on your child's campus. That I'm here to talk to parents when they come to orientation or when they come visit for parent weekend, now on Zoom, but to answer questions so that if your child is away from home at college, that you would know, like, you know what, your campus does have a counseling center or a wellness coach, or this is who you're supposed to talk to. The more you know, the better you're prepared to help other people around you, including your child. And absolutely make sure that your student, your child knows that you are going to be willing to listen and to help. Even if you don't understand what's happening, they may develop a condition or go through something that you don't understand or you can't relate at all. Make sure they know that you are going to help them find answers and try out different things, just like you would if they had a weird physical illness and they couldn't figure out what it was. You would go to the doctors, you would take them to tests, and you would find solutions. And please find a way to let them know that you're willing to do that even when you don't understand or even if you're unhappy with them, right? You might think they know this, but sadly, I've met so many students in my therapy room who are keeping secrets from their parents. Keeping secrets because they believe that you as a parent will only criticize them, will attack them, will freak out on them, and not help them. Which is a scary thing because sometimes bad things happen to them. They may have had a traumatic incident. They may be getting bullied. They may have had other things happen academically with sexual assault, with racism. They may be feeling their health deteriorating, their mental health. They shouldn't be scared to talk to you because we may be the professional counselors, but we know there's nothing quite like knowing that you have loving family support. That even if they did something that you explicitly told them not to, they need to know, even if you're mad, even if you're disappointed, even if you don't understand, you're going to help them find the answer and get their health back on track so that they can continue to meet their goals and regain their health. So don't be afraid. People do recover from mental health conditions all the time. They may have relapses, they may not, but it's not something to be terrified about. It's a very common area of need and concern that comes up during the young adult ages, certainly at all stages in our lives, but especially for 15 to 25. So parents, you are still very important in maintaining the mental health of your young people. Do it for yourselves, your family, and the communities. And yes, keep watching videos like this or looking for books and finding out more to empower yourself to protect their mental health. Parenting's a tough job, but glad you're sticking it through, and thanks for watching.